Welcome to BRR Media. Today I am joined by Cathal Friel, the Executive Chairman of Open Orphan. Cathal, it's great to have you with us again.
Rosie, it's a pleasure. Thank you for having me on again.
Now, Cathal, you've signed a new contract with a top 3 pharma company, which are Pfizer, Novartis and Johnson & Johnson. Can you tell us who it's with?
Rosie, unfortunately, no, it's sensitive, but yeah, that's the 3 top pharma companies, top 3, and it's one of them. That's all we can say. But it's exciting to sign it. We're really, really happy.
And you've also recently announced that you've signed another contract with, again, a top 3 pharma company. Is it the same company as this new announcement, or is it a different one of the 3?
Yeah, 6 weeks ago, Open Orphan has another subsidiary called Venn Life Science, based out of both Paris and the Netherlands, and it signed a CMC, that's a chemistry, manufacturing, control contract, fairly substantial one, also with a top 3, but no, it's a different top 3 today. So I would say in summary, in 6 weeks, Open Orphan has signed 2 of the top 3 pharma companies in the world for substantial contracts. So we think that's a pretty exciting place to be today.
And Cathal, I know you didn't include the contract value on the Codagenics RNS last week. Am I right in assuming that was a similar quantum to figure in today's RNS?
We can't really, Rosie, comment on that. Bear in mind the COVID-19 contracts are very sensitive. We are the only supplier of COVID-19 challenge studies. So naturally, we're going to have to be careful about putting prices up there. I know some investors were a bit concerned why we're not putting, but look, you have to bear in mind some contracts are price sensitive, especially when we go back to quote a similar price to another customer. However, today's is a straightforward RSV challenge study model for an RSV vaccine, and we made it clear it's £4 million. It's starting immediately. All of that revenue will be recognised, the bulk of it this year, small but early next year, and that contract will be finished well before the end of Q1 next year. So that's pretty exciting bit of work to push through the company pipe in the next couple of months.
And Cathal, have you more such contracts coming through in the future?
Absolutely, Rosie. Look, the COVID-19 contracts of which we're working on, and we will hope to announce them in the months ahead. They're substantially larger. We've already guided the market. They're much bigger and of much higher value, but we should probably discuss those when we announce them at the appropriate time.
And Cathal, as you said, you've been guiding the market to expect COVID-19 vaccine contracts, which are of a higher value. Now, when do you expect the first of those to be announced?
Over the next month or 2. Look, we've been only announced we're going to do this type of work on the 7th of March. It takes on average a year or 2 to get a new challenge study model set up, particularly a COVID-19 challenge study model. But we're let's say, breaking all records and getting there. And we would hope to be starting our first COVID-19 challenge study before Christmas. So that means we'll start signing contracts and announcing them substantially before that. So watch this space in the next month or 2 is the way I would put it.
Well, it sounds like it's going to be a busy couple of months for you guys, and look forward to catching up again soon.
Rosie, absolutely. No, really looking forward to keeping updated, but I just think today's announcement is actually rather exciting. As one says, hopefully plenty more of the same to come in the days, months and weeks ahead. Thank you very much.